Hey Doc, I'm now starting to see aging changes on my face. Please do something. I don't like the wrinkles. Okay, yeah. So basically, by about 25, 30, you will start seeing your first signs of aging, but we can sort of manage them. Now, if you see a little bit of like fine wrinkles on your face or a little bit of wrinkles, say on your forehead or some other areas, we can give you Botox for that, and that works really well. For like the rest of the face, what I can suggest right now is you start with what is known as RF skin tightening or radio frequency skin tightening. What it can help with is basically it can start to produce the collagen that or replace the collagen that you're starting to lose under your skin as you age. Collagen and elastin, these are the two things which are basically building blocks under your skin, and this can really help sort of maintain the tone and the tenor of your skin. Again, good skincare is something that you now need to take a lot of care of, such as using sunscreens and moisturizers. And if you have things like acne or something, do meet a dermatologist immediately. So these are the things that I would want you to do. I don't think maybe a tread lift or a facelift would be something that you would require. Hey doc, so I think I'm now getting on in my years and it's showing on my face. What can we do for me? Yes, so 35 is the age now where you'll have to start being a little more careful. One of the main things that you'll have to start doing is sort of having a complete lifestyle change or taking good care of yourself. You'll have to start sleeping well, sleeping on time, eating well, healthy. If you're smoking, absolutely stop smoking and drink in moderation. Plus, if there are any other vices, you'll need to take care of them as well. Because otherwise, the aging that you see on your face is going to accelerate and you're going to see much, much more of it. You'll have to take really good care of your skin using sunscreens, especially in a country like India. You need sunscreen all the time. Otherwise, you will see things like dark spots or whatever spots or pigmentation is there will become darker and it will make your skin look duller. You'll need to use moisturizer whenever there is dryness or as and when required. There are other things such as peels and laser toning and other minor procedures that you can keep on doing that can help you out basically with keeping your skin look younger and fresher, and this does take you a long way with how your face looks, especially from the aging point of view. Second thing I would suggest is basically RF or radio frequency skin tightening. It won't sort of reverse the changes that you are seeing on your face, such as sagging of your face or very big wrinkles. However, what it can really help with is, say, if you take it for the next 5 years, maybe you would have aged 2 or 3 years in the next 5 years, and so it prevents the amount of aging that happens to you on your face during that time. And both face and neck is actually what we would recommend. For the problems you have, which is basically the sagging of the face, the sagging of these what are called as nasolabial lines, the marionette lines, that are the lines going below the lips, the sagging of the eyebrows slightly, we can do what are called as tread lift. Tread lift is basically a procedure where there is a thread with a few barbs that get attached to the undersurface of the skin, and we can pull your skin up. So this action that you're doing, and if it's looking good, we can do tread lifts for them. It's a non-surgical procedure which you can come and get done during office hours. However, it will have a little bit of swelling and a little bit of bruising associated with it for about 5 days to a week. So that would be the downtime for it. But it's a good procedure for somebody in their late 30s to mid 30s. A facelift is something you can do a mini facelift for. We can do a mini facelift for you. However, you have to be aware that the facelift results will usually go away in about 7 to 10 years, and you may require a second, bigger, sort of a formal facelift, maybe in your late 40s or your early 50s, depending on how much you want it at that time. One other non-surgical thing that we can do for you, especially if you have hollowness under the eyes and some areas that is making you look older, is we can do fillers. Fillers again need to be done once a year, like your threads, and they can really help sort of make your face look younger by making it look plumper and refill the areas that have lost that volume on your face. Hey, so I'm 55 now, but this loose hanging skin on my face and this aging is making me look like I'm maybe 65, 70. Can we do something to help me improve my look? Yes. With aging, especially if you're not aged well, if you are not blessed with great genetics, or if you had a lifestyle such as you smoked a lot or you have other issues where you've lost a lot of weight, I mean you were heavy and then lost a lot of weight, you'll have a lot of loose hanging skin on your face by the time you're in your mid to late 50s. You have to understand one thing here. The non-surgical options do work for you in areas such as maybe your forehead or maybe the crow's feet, where we can give you Botox, and that does help. Fillers can go a little bit in sort of refilling the areas that you have lost. However, at this age, especially with a lot of loose skin, you will require a facelift. In a facelift, we basically not just raise or tighten your skin, we also replace the structures that have sagged back into the positions where they actually should be or where they were. We sort of bring the fat pads and the other areas back up, pull it up, and that sort of repositions and gives the face a much younger and a better look. We are not looking to make you look like a 30-year-old, of course. We are looking to give you natural looking results where you look like a 50-year-old. However, you don't look tired or saggy or old, or you don't look like someone who's been through the mill. It's basically to help you look refreshed, though you would look 50. So along with this facelift, we would also recommend doing fat grafting during the same setting where we do fat grafting to the face. So for you, basically, I would not suggest something like a thread lift because you have a lot of loose skin. If you were someone who did not have a lot of loose skin, we could have done the thread lift for you. However, with the amount of loose skin you have, it can gather in areas where we sort of pick up the rest of your face and put it, and so it would not look nice or natural. So thread lift does not work for you, and for you I would suggest a face and a neck lift along with facial fat grafting.